for like the veins, those little spider veins,
Hmm.
varicose veins. What can you do for those?
Well, the really small veins, think, can be treated either with lasers.
Hmm.
There are lasers that are specifically designed for that, particularly if the patient's skin is very white and the vein is very blue or dark red in color. When you have a substantial contrast in color like that, it allows for that to be, and they're very tiny. That's why I call them spider veins. Then that can be treated with a tunable dye laser or other lasers that are specifically designed for that kind of thing.
Do you do that sclerotherapy?
The sclerotherapy is another way that these areas can be treated, and that involves the use of very, very tiny needles in the injection of a sclerosing agent, usually salt water or something like that. It's hypertonic solution into the vein, and that causes the vein to scar down. And once it does that, then there's no more blood flow through that little vein. So those two things are pretty popular for the really tiny veins. Now, um, the laser can treat veins that are, 1 or 2 millimeters in size, which doesn't sound like it's very big, but a 2 millimeter vein is pretty substantial, actually. But once they get much bigger than that, then these veins need to be treated more aggressively. And for that, I think they definitely should be referred to vascular surgeons and people who really, get into that kind of thing.
Right.
Because sometimes you can create a problem with venous circulation by overzealous, surgical treatment of these veins. So it's best left to people who are able to do um, the flow studies and
Hmm.
Dopplers and so forth to ascertain the extent of the venous disease and problem, and also to evaluate many times what the cause of the problem is in the first place. Sometimes there's obstruction to venous return from the lower extremities in the groin areas and other things like that, or there's incompetence in the saphenous vein system, that
Hmm.
sort of thing. So it's not a good idea to get too aggressive with that type of thing unless you really have been trained to do so. Yeah. So, but that's an interesting topic.